Good afternoon and welcome to Birdland Media Works. I'm your host, Danielle Palli, and today I'm joined by Dr. Gregory Kotlarczyk. Dr. Kotlarczyk is the owner of Wellness Concepts, a chiropractic, manual therapy, and functional movement health center. Graduating magna cum laude with a doctorate in chiropractic medicine from Logan University, Dr. Kotlarczyk also holds a bachelor's degree in human biology and has more than 20 years of experience in bodywork and manual therapies. Dr. Kotlarczyk is a continuing education provider for the Florida State Board of Massage Therapy and the National Certification Board of Therapeutic Massage and Bodywork. Additionally, he is the creator and instructor of manual therapy methods, a core technique used in his office. Dr. Kotlarczyk, thank you for joining us today.
Thanks, Daniel. Thanks for having me.
So today, the topic is natural remedies to combat chronic pain and inflammation. Now, medical research repeatedly validates that long-term inflammation in the body is linked to several diseases and conditions, such as rheumatoid arthritis, heart disease, asthma, ulcers, sinusitis, as well as joint and muscle pain. Dr. Kotlarczyk, is chronic inflammation the culprit for many of the conditions that you treat in your office?
Well, that's an easy answer. Yes and no. Yes, because inflammation bombards the body in many different ways. No, because in my office, we typically have patients come in and they are having shoulder problems or hip problems, and we look at it from a mechanical standpoint where the joint and the body structure is not really functioning correctly. Going back to the yes, what we found over time is that inflammation comes in many different ways, either from trauma or from lifestyle changes, diet, stress, lack of sleep, and many other factors. And what we have found is that it creates this chronic low-grade form of inflammation that kind of is a nuisance to the work we're trying to do. In other words, if we're working with someone's shoulder and we're finding that it's not working correctly, we try to fix it, and it's hard to fix that entirely if there's an underlying inflammatory response taking place. And we'll talk more about that here in a few moments.
Okay, but it sounds like what you're saying so far is not one thing. You can't say, here's a pill to take care of that one thing. It's usually a combination of factors.
That is very true. That is, if you don't find the source, you're trying to put a damper or a Band-Aid on something without really focusing on the cause of it.
Now, I'm going to use myself as an example. Now, I have a herniated disc in my low back and a neck injury from a car accident. Now, over the years, I've met many people with similar back and neck injuries. Obviously, there's more at play here than just inflammation, but how does inflammation aggravate situations like these in the long term?
Well, let's talk about long-term and chronic low-grade inflammation. When I talk about stress and lack of sleep and eating dietary components or the Western diet or even sedentary lifestyles, none of us have that, right? So it's one of those things that we're all bombarded with, and it creates a state of chronic low-grade inflammation. And it's not the inflammation that people are used to hearing about. You know, when you strain a muscle or have a back injury due to yours, like from an accident or something, you get heat and swelling and pain and things of that nature. It's not that kind of inflammation. And I'll use an example of glucose or blood sugar, just for an example. So when someone eats a donut or has coffee loaded with sugar, which most of us like, you know, your body has a spike in blood sugar, and the pancreas has to take care of that by releasing lots of insulin. That's really not normal for the body. You know, years back when our bodies were developed, we didn't have refined sugar and flours and things that can create these glycemic lows on our body. So it takes care of it like it should because it's designed to do that. But the problem is the body kind of looks at that as a biochemical trauma, and it releases inflammatory chemicals, one called cytokines. So, and the problem is that it doesn't just release it there, it releases it everywhere. It releases it into the blood. And it's the same kind of response that takes place with infection in immune cells. So it's not just in the pancreas, it's in the liver, it's in the kidneys, it's in the arteries of the body, it's in the muscles, the ligaments. So it's this chronic, low-level state of inflammation that's not, you know, visible per se, but it's just kind of sitting there brewing, creating this higher level of risk for injury or future injury.
Wow. Now, would you say that refined sugars or any processed foods are a big cause of some of this low-lying chronic inflammation?
Yes, I could say that.
People tuning into the show tend to be more holistically minded. That is, they're not opposed to traditional medicine, but often seek out natural remedies first. Can you talk about some of the treatments for chronic pain beginning with what someone can do physically to reduce pain.
Sure. I also believe in traditional medical regimens and believe that they're very important and have a time and place. I also equally believe that we need to pay attention to the simpler things in life, such as this. It's one of those things that if you can focus on more of these natural approaches and lifestyle changes, you can reduce your need for medical intervention. But then again, it's available for us if we do need it. And you mentioned to me that some of the treatments that people can do is from a mechanical standpoint, going back to the way my office practices, is learning about why you have the pain. What's causing that pain? Is it mechanical? Is it a soft tissue component that the muscles are not elastic? Are they tight? Is the joint have arthritis so it doesn't move correctly? Those things are things that are easy to kind of find out. You just have to find the right person to diagnose it and try to do things that keep the body moving. So yoga is phenomenal for that. Bodywork, massage therapy, finding out the corrective exercises that you need to do to bring balance back into your body are really good ways to work on something like that.
Okay, does it need to be a combination of flexibility and strength? Is one better than the other?
Well, you're getting into my office and how I really believe. And I believe in pretty much everything. I think there's a time and place for everything, and every body's different. What might work for me might not work for you. However, in my office, the way I look at it is, yes, it's a combination. I love chiropractic. I think it's phenomenal to have manipulation or adjusting done to the spinal structures and the joints. But I also believe firmly in manual therapies, finding out what muscles truly are tight and loosening them, what joints not mobile, adjusting it or mobilizing it, and then prescribing the corrective exercise to help them restore movement into those joint structures.
Okay, so everybody is really different, because if you've got somebody like me who's sitting at a computer for 40 hours a week or so, that's going to be very different from somebody who's outside doing yard work or something on a regular basis.
Yes, you are the computer athlete.
I don't know that I'd go that far, but okay. So you've mentioned in the past about the use of enzymes and vitamins as part of a treatment plan. Tell us more about what that would entail.
It's kind of easy, but yet it's complex. And I'm going to go back to the basics. Yes, I do like to prescribe or recommend proteolytic enzymes or herbs or various vitamins and nutrients. However, the best way is to try to stay towards more of a Mediterranean type diet, eating foods that are anti-inflammatory and not foods that are pro-inflammatory into the body. That is probably one of the easiest ways to do it, but at the same time, it's the hardest. It is not the way our world is designed. Try to go out to eat and eat something that is anti-inflammatory in nature. It's tough. Mm-hmm. And then I try to tell people, don't live in the bubble. Learn about the bubble, but don't live in the bubble. So to answer your question, when I have someone come in, I like to prescribe proteolytic enzymes. Okay. Reason being, there's about 50,000 different types of enzymes in the body. Your body knows what to do with these enzymes. Very few side effects come with them, and they help modulate this inflammatory cascade that we've been talking about. On the other side of the coin, there's herbs, and I love to prescribe herbs, but there is a little bit of a risk. Herbs sometimes interact with medications, and that can be a problem, but they do work. And just to give the listeners a couple suggestions, as far as enzymes, bromelain, pancreatin, trypsin, chymotrypsin, those are things that people can look for in some of their enzymes. And like I said, there's a lot of them out there, and you just got to find the right research and the right place to look for them. Herbals, the most common on the market today are turmeric, curcumin, boswellia, ginger. Those are just some of the well-knowns, but there's a lot out there, and you can either take them individually or make complexes out of them.
Okay. Now, the enzymes that you mentioned, can you get them in a local health food store? Because to many people, those are going to sound foreign.
This is true, and a lot of times you can. You know, I like online sales. I think it's very good, but be careful unless you know the seller online and you know for sure it's coming from them. Because quite honestly, would you know the difference?
No.
Right. So I'm very big on making sure you're getting them from a source. I really don't care where you get them, as long as you know that source is quality and reputable, and you're going to get what you are purchasing, so you can get the benefit and the result.
And you mentioned that sometimes herbs can have a side effect. Would something like turmeric or ginger, could that have a side effect with a medication?
It can. I mean, there are going to be risks with certain medications. It's one of those things that you need to, depending upon the medication list, you got to just have someone look at it. Pharmacists, especially these new students coming out, they are on this stuff. People are asking for it. So when you go to your pharmacy now and you mention something like this, the likelihood of them knowing might be quite high. And if not, look for local colleges that have pharmacy schools and talk with them. See if there's student interns you can go speak with, because they are, not to say anyone in the field now doesn't, it wasn't the way it was, even 10, 15, 20 years ago.
Right. The predominant thought was it's natural. How can it be harmful?
Correct. Yes.
But maybe back then it was natural when you weren't combining with refined sugar and refined medications that are not typically natural.
That's correct. I call those nuisance variables.
Okay. Now, we talked a little bit about the Mediterranean diet. Could you give people some ideas of some foods that are good to combat inflammation and maybe some foods that are really bad that we should avoid?
Sure. There is an easy way to look at it. If it grows in the ground and it doesn't come in a can and it's not processed, you're probably pretty good on that. If you look at refined sugars, sugar in general you can consider that a refined sugar. Even if you're looking at raw sugar, it's still somewhat refined. Corn syrups, things of that nature, flours, refined grains, flour sources. Those are all refined flours that can produce these kinds of negative cascades that we're talking about. So again, I'm not trying to get people to live in a bubble, but I'm trying to make them aware of that bubble. Another one is omega-6 fatty acids. I tend to push people away from them and stick more towards your omega-3 fatty acids. Okay. Some of the omega-6 oils would be your sunflower, your safflower oils. Some of your good oils that are kind of commonly talked about now is your coconut oil, your olive oils. Avocado is a good fat. So there are sources that you can get good fats from, and you definitely want to stick to them. One more thing that we can talk about, when you read literature, they talk about grass-fed meats. And I would like to, if I can, just take a few minutes to talk about that. People will ask me in the office, farm-raised versus grass-fed animals. And people have to understand that when it's farm-raised, or if it's whole grains, and they talk about that grain most likely is corn. And corn is not bad. I'm not here to talk bad about corn crop. And we won't get into GMO on that, but we're just going to mention corn. Corn has a 60-to-1 ratio of omega-6 to omega-3 fatty acids. 60-to-1, that's pretty high. And as I just mentioned a few seconds ago, omega-6 is, I like to stay away from it because it kind of leads to this inflammatory cascade. So keep that in mind. When you have farm-raised animals, pig, cow, whatever the case may be, they typically feed them what? Corn.
Right.
And fish.
And you're eating what they're eating,
and
essentially.
That is correct. So when they ingest these diets full of corn, they're eating copious amounts of that every single day to fatten them up. I've never seen tilapia in the wild eating corn in the water. Have you? Yeah. So you got to be careful and mindful of those types of things, because when they do eat that omega-6 to omega-3 ratio it's in their tissue. So you're eating like what I call an inflamed meat. And that you ingest, and it just kind of propels that cascade that we're talking about of chronic low-level inflammation.
And now that you're talking, I'm like never going to eat again.
Well, that's why I say don't live in the bubble. My wife loves and hates me. And I say that a lot because it's the truth, and you can't live in the bubble. If you live in the bubble, you're going to need Xanax and Prozac to get yourself through that bubble.
Now, tell us honestly, when she puts down a meal in front of you when you come home, do you just say, thank you, dear, and eat it? Or do you say, you shouldn't have used that, you shouldn't have used that, you should use more of that?
Well, her answer will definitely differ than mine. But I would definitely say that I thank her all day. But she would say, oh, no, 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 no.
She sounds like a very patient woman.
Very patient woman, yes.
Okay. So people listening might be thinking, sign me up. I want to integrate all of these practices in my life between like the movement, the nutrition, any supplements. Where would they start?
There is a professor who I think he's amazing. I think he's very brilliant. His name is Dr. David Seaman, and he has the website deflame.com, deflame.com. I don't gain anything from promoting him. He's been doing it for 30 plus years. I've heard him speak for the last 10. And he has done a phenomenal job on writing literature, researching literature. And he has a very simple, easy to read book called The Deflame Diet. And again, I tell everyone to read it, but, gain knowledge. Mm-hmm. Don't go crazy, gain knowledge. And I think you can get it on Amazon for like $10 on Kindle. Mm-hmm. So for $10, it is a phenomenal read. And he wrote it for non-doctoral level. He wrote it for people who want to know more, are intrigued to know more, and if they want to know more, they can dig more. But you're not going to get truly lost reading it. And then the book, I think, is like $25. So regardless, it's a great find. And then another one that I would recommend is nutritionreview.org. You can go and look for research data. I do like research data. I will tell you that this stuff is still not new, but it's not. It's just now becoming like mainstream. There's not a lot of money in stuff you can't really produce. So
not a lot of money in prevention either.
That's correct. Yep. So, but I do like good research articles, and you can go there and find things that are actually based off of research to validate any points you may be looking into.
Okay. Now, people who want to find out more about the services you provide, first, can you give us a website and a little bit about what you offer?
Absolutely. My office is called Wellness Concepts. You can find us online at wellnessconcepts.com. The services we provide are movement-based, and as you mentioned in the beginning, I'm a chiropractic office that believes heavily on manual therapy and functional movement. We like to find out what's tight, what's taut, or what's not moving from a mobility standpoint correctly, or what forgot how to move. Sometimes we'll take people that have range of motion problems, or they can't lift their shoulder, and then I take gravity and I take parts of their body out of the movement, and I kind of lay them down and I see if I can do it, and then they can do it. Well, nothing's really wrong with that shoulder. It moves fine. It's just when they stand up, it doesn't move. So the brain, the wiring, it's called a neurosensory component, is off. So that's really what I like to focus on, is find those little gems and run with them, because people are amazed when they go, wow, I can't believe that I actually did that. But so that's what our practice primarily focuses around, is the manual therapy, chiropractic, and corrective exercises.
Okay. And it's wellnessconcepts.com.
That's correct.
Dr. Kotlarczyk, thank you so much for joining us today.
Thank you for having me.